Representative Kushner, and good afternoon, everybody, and especially to all the members of the Public Health Committee. I'm here testifying today in support of HB 5278, an act prohibiting an unauthorized intimate examination on a patient who is under deep sedation or anesthesia or unconscious. I give you this testimony today as a survivor of non-consensual teaching practices in a Connecticut teaching hospital. When I was a young child, my family was referred to a physician who practiced out of Connecticut Teaching Hospital to get me treatment for an uncommon skin condition. We were given the impression we needed somebody who specialized in treating the condition in children, and we were told this teaching hospital was the only option. Whether we wanted a teaching institution or not, this was where we had to go. And when students entered with the attending physician, my family was under the impression we had to let them stay. The language allowing them to be there was vague and buried in the middle of consent forms, much the same way language allowing intimate exams under anesthesia or sedation or while unconscious often is currently. We didn't understand what we were signing up for, much the same way many of today's victims of unconscious intimate examinations do not. That was the first time I was forced to show my naked body to strangers for the purpose of furthering their education. The first time I was reduced from a human being to a teaching tool, an object, or an exhibition. The first time I learned what it felt like to be violated. It wouldn't be the last. It continued roughly from age 8, 9 through age 14, several times a year, every year. At every appointment, the doctor would walk in with whatever doctors in training would be viewing my naked body that day. Sometimes they also photographed me. At each examination, the doctor examined my full body. By itself, an examination is innocuous, a necessary part of healthcare. But during these examinations, he put my naked body on display for his students like an exhibit or a sideshow. I was forced to lie on a table while he pulled back the flimsy paper gown I was wearing to expose my chest, my back, and my belly. The part I hated the most was when he would pull down my underwear to expose my buttocks and genitals. To this day, I can feel his hands on me on my stomach, pulling down the thin piece of cloth that protected me from the strange eyes standing behind him, staring at me. I was so acutely aware of those eyes gaping at me, like someone usually gawks at an animal in a zoo, that I could physically feel them on my skin. They had no regard for my dignity, my privacy, my well-being, or my feelings. They only cared about how they could use me, how the use of my body was furthering their education like a practice dummy or a textbook. I was made to feel lower than an animal every time I stepped into that institution's exam rooms, and I have been left with a lifetime of pain and anxiety, along with post-traumatic stress disorder because of what was done to me. I have flashbacks, panic attacks, and nightmares, along with an intense fear of doctors and healthcare in general. Earlier today, Dr. Amy Brown of Hartford Healthcare shared spoken testimony, and she also submitted written testimony that stated, in part, the ability of patients to exclude trainees from even observing seems illogical. Her testimony, along with the written testimony of Dr. Anthony Tarantino, also of Hartford Healthcare, urges the committee to amend the language in the bill so that patients cannot mandate the trainee be excluded from observing the exam.
Excuse me, Ms. Fry, your time is almost up if you would
I'm wrapping up, thank you.
Thank you.
I hope that by sharing my story, I have shown how wrong Dr. Brown and Dr. Tarantino's assertions are and just how much harm even non-consensual observation can do. Patients should and must have the right to refuse any portion of student or trainee involvement they wish. We do not go to the hospital to train the next generation of doctors. We go for medical treatment. And some of us only have access to a teaching hospital and simply cannot choose a private option without students present. I submitted along with my written testimony a list of over 107,000 petition signatures from individuals who are urging the passage of this bill with the language prohibiting student observation included. We are depending on you to pass this critical legislation and protect us when we can't protect ourselves at our most vulnerable moments and prevent us from being violated when we are sick and need care. Thank you for hearing me today. I'll stop there and leave it at that.
Thank you, members of the committee. My name is Ashley Weitz. I am a victim advocate and trauma-informed care consultant in Salt Lake City, Utah. I'm here today to speak to HB 5278 about non-consensual intimate exams on patients in healthcare settings. In 2007, I went to an ER here in Salt Lake for uncontrolled nausea and vomiting. Lots of labs and imaging did not yield many answers. I have the note here from the encounter, and the physician says, I've been seeing this 23-year-old woman in the emergency department. I had anticipated she would be discharged. However, she persists in having tachycardia and appearing quite nauseated. I treated the patient additionally with a medication. I had held off of another more sedating medication, expecting her to be able to drive home. But at this point, since it was not the case, I gave her that sedating medication. She has had some improvement in her nausea. She is quite somnolent. I was very, very asleep. He continues, also there are symptoms. It is unclear the exact cause. I performed a pelvic exam. I know that we never had a conversation about this pelvic exam or why this physician thought that he needed to do it. And I know that I never consented because I woke up in stirrups screaming. As a survivor of sexual abuse and assault, the experience was as confusing as it was traumatizing. It was not until 2019, when similar legislation was introduced in Utah, that I finally realized that it had felt like a violation because it had been one. My experience has impacted the way that I seek and receive medical care. I have gone without necessary care because I've learned through experience that at my most vulnerable, I can't trust that my autonomy will be honored. My non-consensual exam was a product of the way that that clinician learned. No one ever has any reason to stop doing what they don't consider to be wrong or harmful. There are many professional association guidelines about informed consent and laws in 20 states, but we know that this is still happening. We as patients are saying, please just ask. The risk of asking is so much less than the risk of causing lasting harm. Repeated student exams for learning purposes are not patient care, and patients have every right to consent to be a part of learning. In no other profession does society tolerate the practice of routinely instructing learners to penetrate people without their knowledge or explicitly informed consent. I've submitted written testimony refuting arguments that come up commonly against prohibiting the practice, and appreciate you reviewing it. In just a few ways, I honestly don't feel like this bill goes far enough. But I also know that any measure of progress is still progress. This bill, if moved forward and passed, will help patients and providers in Connecticut and elsewhere. And I appreciate your consideration and votes in support of HB 5278. Thank you.
Good evening, and thank you to the respected members of the Public Health Committee. My name is Samantha McCoy, and I am testifying today in favor of House Bill 5278 on behalf of Warriors Care. Warriors Care is a national nonprofit organization dedicated to ending sexual, physical, and emotional abuse. House Bill 5278 prohibits the practice of non-consensual intimate examinations on unconscious patients. This bill ensures autonomy and dignity to the patient while still permitting students to practice their clinical skills through a standard of explicit and informed consent. This bill poses no threat to the quality of education that medical students receive and ensures a minimum level of respect and care towards patients. If asked and informed ahead of time, there are patients who will consent. This is the proper and only permissible route in which a physician should perform intimate examinations. Clinicians travel to Connecticut to practice from throughout the United States with a variety of educational and professional backgrounds. And there is certainly evidence that this practice goes on throughout the United States. For example, Dr. Silver Eisenstadt, who submitted written testimony in support of this bill, co-authored a study called Don't Ask, Don't Tell, where he surveyed 401 students at 5 Pennsylvania schools. He found that 90% of medical students had performed pelvic exams on anesthetized patients, and that there was a reduced appreciation for the importance of consent in these patients. That is simply frightening and flies in the face of the consent culture we are trying to foster. It raises the question, why is there so much resistance on simply requiring explicit consent? It is a simple ask to a patient that will not only maintain respect and trust for the medical professionals, but will also ensure a standard of consent throughout the entire medical community. Approximately 19 states have now outlawed this practice, including but not limited to Texas, New York, Virginia, Iowa, Hawaii, Utah, and Delaware. With all due respect, I want to briefly address Dr. Amy Brown's testimony from earlier today, which argued that the bold font in the bill explaining what procedures to come should be removed because it will draw undue attention to that section. To me, that is a concerning proposition. The bold font states, and I quote, "consent for examination of pelvic, prostate, or rectal region." That language assists in explicitly informing the patient what will happen. Why would attention being drawn to the explanation be unneeded or undue? In fact, that is the very definition of explicit and informed consent. To try and hide such information is neither informed nor explicit. We are not the only voices in support of this bill. An overwhelming 107,000 individuals have signed our petition in favor of this bill's passage. Each signature signifies a human being who is frankly horrified of the idea that such a practice continues today. Each signature is further calling on the respected members of the Connecticut legislature to protect its constituents and ensure medical staff are respecting their patients' rights to say no. Thank you for your time and consideration, and I look forward to your favorable votes on House Bill 5278.
Thank you for letting me appear in support of 5278. My name is Robin Wilson. I'm a law professor at the University of Illinois, but I speak only for myself and not the system. I urge enactment of 5278, which would prohibit intimate pelvic, prostate, and rectal examinations on deeply sedated, anesthetized, or unconscious patients for medical teaching purposes, unless the patient consents in writing or electronically. 5278 will ensure that norms of autonomy for all persons are honored and no one is treated as a means to an end. It would place Connecticut squarely within the 20 states, giving patients the right to decide whether medical students will perform intimate exams on them for the students' learning. My written testimony, page 2, shows 19 of these laws. I'm sorry, are you able to hear me? New Jersey became number 20.
We could hear you, you just muted.
Or coming up at the end of Hill Street.
I'm so sorry. Can you hear now?
Yeah.
Better. Okay. So we know exams happen in Connecticut without consent. A March 1 email shared with me from Yale's OBGYN department said that its recent policy revision was needed because, quote, this practice was done without consent. I speak to medical school student chapters all over the country, including in Connecticut. 2 women medical students told me that they had been asked during rotations in Hartford to do exams that they believed were unconsented to. Medical students are afraid to face down attendings about the need for consent. It can affect where they land for their residencies. It can affect their lives. Asking consent provides a teachable moment for the next generation of healthcare providers that respect matters. It relieves their moral angst. Now, some say that intimate exams are no different morally than suturing a wound. Many patients, like Ashley Weitz, who testified earlier, are sexual assault survivors. Men and women might actually flip out too, to know that rectal exams are being taught on them without consent. Some people say that patients have impliedly consented upon admission to being practiced upon. They have not. Patients with insurance go to in-network hospitals because they have coverage. Many, quote, public patients go where they can, not because they agreed to be practiced upon. And this is on pages 8 through 11 of my testimony. Standard consent forms obscure the kind of teaching being done. Yale's general consent form, which was excerpted in the Connecticut Mirror last year, leads a reasonable reader to believe that everything being done is being done for the patient's benefit, not the student. Requiring informed consent for intimate exams will not shut down medical education. Lucy Nolan gave their stats on page 11 of my letter. But it turns informed consent completely on its head to say we can't ask you because you might not say yes. Now, this adds no burden to securing consent, as I show on page 3 of my letter. Hospitals facilitate doctors' consent duties now. They can simply add the clear text right from the bill into admission forms.
Excuse me, Ms. Fretwell-Wilson, your time is almost up. If you could please summarize.
Last sentence.
Thank
So
you.
many believe that self-regulation is enough, but community hospitals are far-flung, as I show on page 8 to 9 of the letter. And so it takes strong norms like positive law to actually change behavior. Medicine is pervasively regulated. Last point, if COVID has taught us anything, it is that trust in healthcare matters. Patients should be enlisted as respected partners in medical teaching. Thank you.